And thank you so much for having me, Ms. Harshad. I appreciate the opportunity and hope that we can help our community. So I'm going to go ahead and get started. Like Dr. Ghislaine said, I am Dr. Antonia Levy, but Antonia I go by. And today we will be talking about the understanding perinatal mood disorders. Before I get started, can you see me as well as my screen okay? Can you see
Yes.
my screen and my, okay?
Yep.
Okay. So in the webinar series, we will be addressing multiple areas. The first would be understanding the perinatal mood disorders. That's the beginning. So while mom is pregnant or before mom gets pregnant, but more so while mom is pregnant, what are some of the mood disorders or what are some of the issues, mental health issues that could be present? And so in this webinar, we would like to ensure that we leave with certain key points, some of which would be one, identify the different mood disorders that are existent, meaning what types of mood disorders do women experience while they are pregnant, as well as postpartum. So today we'll identify some of those in while mom is pregnant, and on Tuesday we'll delve further into the postpartum piece, and then I believe on Wednesday we'll talk more about the substance exposed cases, which I believe is probably the most interesting, just because of the type of work that I've done before and some of the experiences that I would like to share with you moms, just to help you understand that we've all gone through certain things, and together as a team we can heal, and we can achieve the emotional stability as well as connection that we want and have with our children. So the objective for this for today's presentation would be that we will be able to identify the different types of mood disorders, and we will be able to identify the causes and treatment modalities of mood disorders, and most importantly, postpartum in particular, because a lot of us women struggle with postpartum, oftentimes undiagnosed, and as well as unspoken. So we don't share it, or we may not even know what the symptoms present as or what they look like. So today we'll talk about that and see what they look like, or what they present as. So we will also be able to identify the major symptoms of most mood disorders. So the common 6 or 7. There's a myriad of them, especially with our new Bible. Well, in psychology, we have our Bible, but with the new Bible, there's so many of them, but I don't think that's necessary to go into today. We will also be able to identify effective treatment approaches, as well as available community resources in the DMV area, but more so in DC. So to get us started, I want to share what some mothers and women have said about being a mother. Oftentimes, people have the misconception that being a mother means, well, being pregnant means that you're elated, you're happy. It's the best thing that could ever happen. Well, then sometimes they don't know what comes with that. They don't know that, well, maybe mom is struggling with certain areas, and maybe she's not emotionally ready, or maybe mom is ready but she doesn't have enough support. Oftentimes, when we don't have support, it affects our ability to be our best selves, as well as be the best version of ourselves while we are parenting. So I would like to share with you some women's assertions about being pregnant, and I hope you can identify.
The biggest thing I learned about pregnancy was that it is not joyful for everybody. I always wanted to be a mom, but I never wanted
Sorry.
to be pregnant because I always was really freaked out about the whole confinement of it. That's what it always seemed like to me.
I thought that being pregnant was going to be awesome.
Just a magical time of just rest and relaxation.
I just thought it was going to be like the cutest.
You know, they kind of glamorize it in the media.
Uh-oh. Is this your apology?
Yeah.
And I think I was especially excited about not having to suck in my gut.
Yes, there will come a day when you realize you can't see your vagina and you can't like primp.
How hard it would be to experience the skin stretching out.
Morning sickness doesn't mean you throw up sometimes. It means you feel nauseous for like 3 months.
I wouldn't really be able to fall asleep easily.
Even though you don't have your period for whatever, 10 months or something, you still have to wear a panty liner every single day because you will have crazy, disgusting discharge.
I didn't know just how much space my stomach was going to take up.
And it's scary to see your body change so drastically in such a short amount of time.
When I became devastatingly sad, pregnant, I had no idea that what I was dealing with was antepartum depression.
I haven't had a very strong relationship with my mother, and so becoming a mom has been a very interesting.
Postpartum depression in general, I think maternal mental health overall was something that I felt really unprepared to deal with. I had never struggled with mental illness.
The fear is intense. Fear is present.
Worst mother ever in our own minds. I think postpartum depression or not, there is a moment where you will feel like you have done everything wrong.
And it feels out of control. And that's the big thing I think I've learned from pregnancy is that it is the ultimate lesson in learning to let go.
It's worth it in the end. It's truly a magical experience.
For me, it's been very messy and very primal and empowering at the same time, and exciting and scary.
So I think you just have to kind of keep the faith that, like, you know, yeah, you're going to mess up and there are going to be moments when you feel like my baby's screaming and I'm sweating and I can't get my boob out and everyone's looking at me and I'm a terrible parent, but you're the perfect parent for your child. The biggest thing I learned about pregnancy
Okay.
is freaked out about the whole.
Now we're moving on to the next slide. I can't see everyone's faces, but I now want to pose a question to all of those who are watching. I would like to make it a little bit more interactive, if that's okay, as well as just it's Friday, and I want to make sure that we're still awake. But more so, I want to know if anyone can identify with what has been said, what the video was sharing. I know for me, I can certainly identify that being a new mom, there are struggles that come with that. Can anyone identify with any of the females that spoke about their experiences about the mental health struggles while being pregnant? Megan says, yes, definitely pregnancy was not great. I agree. I absolutely agree. Yes. And part of that is the fact that, one, you're going through bodily changes that only you can understand, as well as only you and other mothers or other people who have gone through the same can understand. And it's a beautiful experience, and it's also a painful one for some of us, right? But the good thing is to know that we're not alone, and it's a shared common understanding. I want us to feel as though it's normal to feel the way we feel when we are pregnant. It's normal to feel like we're not the best when we are pregnant, or even when we have kids. It's okay because we're all experiencing the same, but we may not say it or share it. But these are thoughts that are present in some women, and we shouldn't be vilified or shamed for having those emotions. So if you are experiencing, or if you experienced some sadness, not feeling like your usual self, and of course the wonderful discharges that they graphically explained, you're not alone. We can empathize with you. So what are some of the mood disorders that come either before or even while pregnant Now, the major ones are major depressive disorder, bipolar 1, bipolar 2, cyclothymic disorder, as well as premenstrual dysphoric disorder and adjustment disorder with depressive symptoms. And of course, the big ticket item, which is why we're here, which is postpartum as well, postpartum disorder. Now, just to kind of break it down a little bit for us, and yes, these are big, these are clinical terms. What do they mean? I mean, they have meanings, and they all fall under the same category of mood disorder. What is mood? Mood is how you feel, right? Your mood. Do you feel happy? Do you feel sad? Do you feel euphoric? Do you feel like you're on top of the world? Do you feel as though you're depressed and the world is ending and your world is crushing, crushing you down? Do you feel overweight? These are all moods and emotions that we experience as women, as humans. And sometimes we forget that it's a shared experience oftentimes, but we don't talk about it because of sometimes stigma, sometimes even society. It's easier to say, I have a headache than to say, I'm feeling hopeless or I'm feeling depressed because of stigma. However, today I want us to be able to unveil that and know that it's normal to feel how you feel when you're pregnant, after you're pregnant, and going forward. But the caveat to that is when it starts to affect our daily lives, when it's affecting our ability to go to work, when it's affecting our ability to do the things that we typically would do, take care of our kids, as well as just having a well-balanced, healthy life, that's when we will seek treatment. Okay. Now, so what is major depressive disorder? Major depressive disorder is pretty much the big daddy of it all. Meaning, it's more evident. You start noticing that you're feeling hopeless. You're feeling empty. You're feeling as though there's a doom gray cloud all over you, just towering you and just hanging out there, and it's not moving. And you feel as though you're in a pit that you can't seem to get out of by yourself. You struggle with concentrating at times. You also struggle with being able to articulate what your needs are. Sometimes you will think that you may not enjoy certain activities when you actually used to enjoy them. So you have a diminished, ability. You will not enjoy the things that you typically would, and you would find pleasurable. You would not want to seek them out. You would want to be in your bed and probably cry while you're in bed. And people will call your phone, and you may not even want to talk to them. Why? Because you are feeling the way you feel. Oftentimes, the diagnosis comes after the symptoms have been present for over 6 months, consistent within the most recent 2 weeks. So in a nutshell, major depressive disorder is more so the big, well, not the biggest, more so, but the overarching, the mother of all mood disorders, pretty much, because every single one of them will have the same or similar characteristics, but in different time spans, as well as different. So some will have similar, some would have more, some would have less, and some will have, the durations are different for diagnosis. That is. So what is, and the next thing would be bipolar 1. Bipolar 1 is very, it's similar but different from major depressive disorder. The difference between those two are, one, the manic episodes, the risky behaviors that come with that. There's typically an assessment that's done. The assessment that's done typically will ask you questions about have you ever in your life had, or have you ever in your life had times where you felt as though you were on top of the world, or you could accomplish things that you typically wouldn't be able to accomplish, as well as would you say you've ever engaged in behaviors that have cause you to either lose your family, such as infidelity, or such as excessive spending, or maybe having days, periods of days where you're just feeling hopeless and helpless and lost and empty, and just fatigued and just tired, and you feel like the whole weight of the world is on you. But then you notice that 2 weeks later, roughly about 2 weeks later, or based on your cycle, because everyone's different but yet similar, the next couple of weeks, you notice a difference where you are feeling invincible, feeling like you're on top of the world, feeling like you can do things that when you are not even feeling depressed or manic, so to speak, or in that high state of being extremely happy. That the baseline is what we would call it, the baseline. So when you are closer or away from your baseline, you would know. Or if you don't know, explaining it to a provider who's able to kind of help you piece out patterns in behavior to be able to identify a baseline for you would be beneficial. Now, bipolar 1 and bipolar 2 are pretty much similar, except the mania piece is also not present. In bipolar 2, it's more so of a depressive phase, but the behaviors that are, or I don't want to say behaviors, more the activities that we engage in are not the best activities for our well-being. So let's say, for example, let's say I have rent due, but because I just don't, because I feel the way I feel today, I'm going to go shopping. I'm not saying that's a bad thing. It's not a bad thing, but that will mean that we can't pay rent, right? Or let's say, for example, I know someone who I used to work with literally woke up one day and drove from the East Coast to California, and then came and literally called me while in California and said, "Hey, by the way, Antonia, I'm in California." I said, hold on. How did you get to California? Didn't I just talk to you 2 days ago, 3 days ago? Oh yeah, I woke up the next morning and I felt like being liberated. And so that emotion, that right there is part of when we are in a manic phase, if that makes sense. We feel as though we can get it done, and we do get it done because we are in a euphoric state. But with bipolar 2, we don't have that mania, which is what it's called, like euphoria. We don't have that time where we're on top of the world, calling friends in the middle of the night, or just finishing a project just because we know, because we feel like we can get it done at that particular time. So that's bipolar 2. Cyclothymic is more so a mood fluctuation. I'm not going to say too much about that because one, it's very similar to the other mood disorders, but the caveat is it's often misdiagnosed, and mostly we women are the ones who often get labeled as oh well you're moody, or I don't understand what's going on with your mood, or whatever the terminology is, but the reality is, well, no, I'm not crazy. I'm not an angry person. I'm going through what I'm going through right now, and there is a diagnosis that's attached to that to help me be able to obtain additional resources, and we'll talk more about that later. So cyclothymic is more so the mood fluctuations, and it's specific to you. It's not a broad. It's not as broad as the major depressive disorder. And I'll leave that as it is. Now, the premenstrual dysphoric disorder, I believe we can all certainly identify with this because, well, first of all, has anyone ever felt low energy, fatigue, just tired, and not in the mood to do anything, like a week before your period? Like, has anyone experienced that? Just out of curiosity, you have? Yep. Me too. It's always that, the week before, right before your period comes, you start noticing that something's not right. I'm a little bit more snappy, like I'm irritable. I'm not trying to talk to anyone. If you talk to me while I'm going through that phase, ooh. So the caveat to that is because our bodies are also going through hormonal changes, and we release an egg, and the egg is going to rupture, and so the body is doing its work. But what does that leave us? It leaves us feeling either fatigued, tired, bloated, and just low energy and not wanting to be around people. I know for me, I don't feel like myself when right before my period, or even throughout that time. So just know that these are normal emotions and feelings to have, and this will go away on its own um, without considerable treatment. But if it becomes debilitating, that's when I would recommend seeking additional help, and we'll talk more about that as well. Now, another one is adjustment disorder with depressive symptoms. So typically, this is more so when we, like now, when we are experiencing something that is abnormal to us, like abnormal to our daily, no, our day-to-day activity. Like now, we're online. Typically, maybe this will be done on ground, right? A face-to-face interaction. We're talking. We're laughing. We're getting to know each other as well as getting the information. But we're doing it online because we are in a pandemic, and sometimes, and I don't know about for everyone else, but for me, I know COVID has had an impact on my mental health. Period. Being cooped up at home and being having to just stare at my four walls as well as a computer. Yes, it does have an impact on us. So we shouldn't minimize how we feel, especially now. If you're a mom and you're going through and you're pregnant or you're going to have a baby, I mean, I can only imagine how it feels to be going through a pandemic, as well as being pregnant, as well as all the cares and anxieties that come with childbirth. Um, while we're in a pandemic, I can certainly empathize, and I can't say that it's easy, but it with support it's doable. But nonetheless, it's a phase, and these are emotions that we should not minimize. So if you are feeling as though you're not your usual self, you may have lost your job, in addition to being in a pandemic, in addition to being pregnant, now you've lost your job. That's that's a compound loss, and that's compound emotion, so to speak. Or maybe just not. Maybe you've lost someone in your family. A loved one died from COVID. That takes a toll. That takes a toll, especially if you're pregnant as well. Monitoring the difference between when you are just going through a situational depressive state or a depressive episode, which we all have. I mean, you show me one person who hasn't had it, I'll call him a liar, because we've all had transitions in life, because the only constant in life is change. So we've all had transitions in life, and it's all about how we are wired, one, and how we adjust to the change. We don't respond the same way. I'm comfortable doing virtual. Some people will not do virtual at all. They'll only do phone or in person, as well as the coping styles are different. I think the ladies, this webinar today, you guys are very resilient to be able to, one, adjust very well to technology, adjust to what the world is just thrown at us, and also being a mom or to a mom to be, while all of this is going on. I mean, it takes a lot of emotional strength, and I applaud you for even coming or even listening and watching this, and just you are supported and supported as well. But adjustment disorder, it can sometimes anxiety as well, as anxiety and depression. So just knowing that could be present, just because we're depressed doesn't mean that we can't be anxious about what I'm going to feed my child when I give birth. Because I am depressed doesn't mean I can't be anxious about, well, do I have a car seat for my child? Well, I lost my to get a car seat from. I don't want CPS in my business, but these are all worries that that a mom can face while being pregnant and also not having support and also in a pandemic. So know that if you are going through that, if you're experiencing any of these emotions or any of these, or you have any of these experiences, I always advocate for reaching out, reaching out, reaching out, reaching out. Sometimes we don't have those resources readily available, but I know that the Department of Behavioral Health, they work extensively in making sure that the community is served and that the community has the resources that you need. So please, please, please reach out and know that the resources are there for you through the department as well. And now we move on to the main reason why we're here, which is postpartum. Postpartum is, we will address on Tuesday in more in more depth. We will address it on Tuesday in more depth, but I do want to touch on it a little bit because that's why we're here. And a lot of moms who have had any type of mood disorder are at a higher risk or have the propensity to fall into to have postpartum depression. Now, what does that look like? You ask. Well, postpartum sometimes can present as not wanting to bond with your child. That literally your child is staring at you and you're staring at it. Sometimes, some moms will literally leave their child at the hospital and just leave. Why? Because not because they're bad moms or because they're bad parents or bad humans. No, because we're going through an emotional. Being a parent is such an emotional task as well as physical task that without all the resources, without all the treatment that we need, as well as people around to help us, it can quickly spiral and we can quickly lose our kids. And I will talk more a little bit about CPS later. Later in the week, I did work closely with CPI investigators and newborn case, but knowing what protective capacities look like and knowing what you need as a mom and knowing the resources will be important. So with postpartum, sometimes you will not feel the connection with your child. You will feel as though you're a failure as a mom. You will feel as though you are not prioritizing your child. At least others will tell you that as well, further reinforcing the negative self-talk that we already have, because oftentimes when we have we feel as though we're not good enough. We fall into a state of emptiness, a state of hopelessness, and we separate ourselves emotionally from the child. If you are feeling that way, or if you've experienced this, you would understand what I mean. But it doesn't mean that you are a bad person or a bad mom. It just means that we need to have resources available, which now to be able to help address that. So that's what I'm going to say about postpartum just for today, because it's such a broad topic, and I want to make sure that we are not only we know how to assess what it looks like, as well as how to reach out for help within our communities, BH, as well as family support and treatment, medical treatment as well. We have one more video, and please let me know if I'm out of time. But I have one more video here that I think will be beneficial in understanding perinatal mental health in particular. Can you see it?
Pregnancy and having a baby.
Okay.
press play. Baby, bring about big changes.
Better now?
Because of these changes in your body and in your life, there are things you need to know about your mental health. The period of time, which includes
I'm so sorry. I keep doing that again.
pregnancy and 1 year after giving birth, is called the perinatal period. Up to 1 in 5 women struggle with their mental health during this time. And the most common conditions are depression and anxiety. Depression and anxiety are different from normal sadness and worries. Normal sadness and worries disappear over time, but depression and anxiety last longer and impact your day-to-day life and sense of well-being.
How do I know if I have depression or anxiety?
You may experience some of the symptoms. You may be depressed if you often feel sad or don't enjoy doing the things you usually enjoy. Also, you might sleep more or less than usual, feel like eating more or less than usual, always feel tired, have trouble concentrating, have low self-esteem, or have feelings of guilt. If your depression is very serious, you may even have thoughts about not wanting to live anymore. You may have an anxiety disorder if you often feel nervous or anxious, or you're unable to stop worrying, and this comes along with bodily changes, such as nausea, trembling, dizziness, or trouble sleeping. Some people may experience both depression and anxiety at the same time.
I have been feeling many of these symptoms, but I'm not sure if it's just because of my new baby.
During pregnancy and postpartum, figuring out if you have depression or anxiety becomes complicated. Symptoms of mental illness can show themselves in particular ways that are different from usual. You may feel overly worried or anxious about the health of your baby. Sometimes you might not be able to sleep, even when the baby is sleeping. Or you may feel uninterested in your baby. You might have feelings of worthlessness and wonder if you're fit to be a good mother. You may have unwanted and upsetting thoughts, especially about your baby, or a flooding of traumatic memories. You may be more irritable than usual. You might wish you could be somewhere else, or have thoughts about escaping your own life. Not everyone has all the same symptoms. Cultural differences and lifestyle differences mean that different people will experience different symptoms in different ways. If you have several of these symptoms, and they happen for most of the day, almost every day, then you might have depression or anxiety. Remember, these are very common conditions to experience during the perinatal period, and no matter your situation, it's not your fault.
I do feel like I'm going through some of the things you've mentioned, but I thought that pregnancy and having a baby were supposed to only make me happy.
That's a myth. In fact, you can really want a baby and be really excited, but still have sad thoughts and struggle with mental illness. If you think that you're experiencing symptoms of mental illness, then you should talk to your healthcare provider, such as your midwife or your doctor. It may be hard, but it's important to talk to someone who can connect you with treatment to help you feel better. Feeling better will help you, your baby, and your family thrive.
Please take care of your mental health by telling a healthcare provider how you feel if you're experiencing some of these symptoms.
All right. Did I mess it up again? Hope not.
So we have a question in the chat. How do you know if you have postpartum depression or it's just the baby blues? Because we know that a lot of moms go through the baby blues.
Because of these
Sorry, say that one more time. How do you know you have postpartum depression, you said? Gigi?
Oh, sorry. I said, how do you know if it's postpartum or just the baby blues? I thought the video was done. It's okay. You could
Well, so
video.
great, no, great question. And we'll talk about that. Well, we want people to come back on Tuesday, but how do you know the difference? The difference is postpartum is a lingering emotion. There's a piece where you are disconnected, and sometimes you want to kill. Some people have experienced wanting to harm their kid. That's one of the characteristics. Okay, being so disconnected from your child and not having that bonding is different from the blues. The blues is more so depression, feeling down and out, empty, low, sad, not good enough, not eating enough, overeating, or just a low energy, low emotional strength. But the the difference is you have a baby. The baby also needs mom present. The baby needs mom to be affectionate. The baby needs mom to feel good enough, because what the way the mom feels will affect how the baby feels. But with being having blues, it's more so a situational. It's situational versus a postpartum depression. The length of baby blues typically will last maybe 3 months roughly. Postpartum can linger on. It's more likely when you have either bipolar 1 or 2 prior to being pregnant, as well as if you have maybe some substance dependence as well. So we'll talk more about that on Tuesday and Wednesday, but those are some of the characteristics that that I know, as well as that I have seen as well. A mom who had postpartum had bipolar 1. Prior to being pregnant, she was diagnosed with bipolar 1 disorder. She was engaging in all types of maladaptive behavior. She was doing things that would not that were not beneficial for her own health as well as her family's health. In turn, she was used to running away from problems or used to escaping. And so when she had a baby, the connection between her and the connection that a mom has with their child, the whole, while you're, what do you call it? When skin to skin, she didn't want to do skin to skin because I was in the hospital with her as well as a CPI. She didn't want to do skin to skin, but she was also not on her medication as well as cocaine use. Okay, so we don't want to say it's just one problem, one area of struggle. It's more so multifaceted. That's specific to that person. So you may not be a runner, or you may not present as a runner, but for me, I may just want to run away from my baby and my family because it's too much. Some women have, one lady left Florida and without her kids and ran across state, well, to New York. But then they ended up finding her in Maryland with another child, with an older child, not her baby. She left the baby behind, but then went with another child because the child was more independent. So that's how you would sometimes see it. The more dependence the child has on the mom, the more disconnected sometimes mom may feel. So that there's a difference between that and having the blues. The blues will come and it will go. Postpartum will not go unless it's treated. I hope that answered your question.
Thanks.
Awesome. So I already talked about most of this, so I'm not going to belabor too much of on that slide. But I do want to talk about treatment. But before we even move on to treatment, do we have any other questions that you would clarify or at least answer? Thank you, Gigi. can anyone, well, not to self-disclose, but can anyone empathize or at least understand what, what the ladies in those were alluding to, or what they were sharing, the struggles? Can anyone identify with them at all? I know I can. When you're pregnant, you don't feel as beautiful as you would typically feel, right? When you had a baby or two, you want to work out to look like what you had, where you were before. But sometimes I just don't feel like working out, and that's okay. So, but if that's you, and thank you, Megan. Yes, she said yes, definitely. Yes, I mean, we all go through this, but we don't talk about it. We don't talk about it because oftentimes we're shunned by society, by stigma, or by even our loved ones. Because unless they are, you said bodily changes, Gigi. Yes, absolutely. Your body changes, and you're no longer the person. At least you don't feel like you yourself before baby. I mean, your body is stretching. You have a 6, 7, 8 pound baby inside of you. That's huge. As well as trying to manage your mental health, as well as trying to make sure that you have everything you need for your new baby. Babies are expensive too, so that's additional stressor right there. But I'm not going to get into into too much of that today. But yes, we can certainly empathize, and now I can really empathize because I have one, and I know what it feels like to be burdened, as well as to feel the love, as well as to know that when you are feeling low, tired, hopeless, um, having crying spells when the baby can't sleep, or because the baby you don't know what to do, it's a normal emotion. Okay, we all, most of us experience it, and we just don't talk about it often. Okay, so what are the treatment modalities to help with all of the mood disorders that we've kind of talked about earlier? Well, not every single one of the mood disorder will require the same therapeutic or the same treatment. For adjustment disorder, so I'm going backwards now. For adjustment disorder, oftentimes you don't need medication at all. Oftentimes, a good six session with a therapist will do the magic. Like, honestly, like 6 sessions with a therapist, while you're going through that, while you're going through the throes of life, the change will do it. You may not need medication. Now, the caveat to that is if you've lost someone, if you've lost your child while also being pregnant, then we look at what's called compound bereavement, so to speak, and then we want to watch out for going from a just with depressive symptoms to more of a major depressive disorder, just because it can linger on, and having multiple losses have a way of weighing, taking a toll on us emotionally if we're not careful. Especially when as women, we also have hormonal changes that's going on, and we're cooking a human being really. We're birthing. We're doing the miracle of birth. I mean, we're cooking a person inside of us. There are things happening that we can't see, that no one else can understand but you. So it's okay to be kind to yourself once in a while. I say every day. So medication. So when do we need medication? We need medication when we have certain mood disorders. So for major depression, that is lingering and festering for a year. It's been happening for 6 months to a year, and we're not changing, things happening. When I would say, let's get evaluated. Now, if medication is not something that we want, because of course, who wants medication first? We want to try what other things, so we're not dependent on medication, as some people have told me. But medication is also very, very, very beneficial when it comes to our chemical imbalance, and making sure that we are able to cope with life, life of being a mom, life while you're pregnant. And some medications are safe while you're pregnant. Some psychotropic medications are safe. So just know that not all of them are recommended, but know that you can also seek medication treatment while seeking therapy and while pregnant, as well as post pregnancy. Major depression would be one that typically would require medication for a smoother transition. The other would be bipolar 1 and 2. Oftentimes, what I've noticed is some of the moms that I've worked with, in order for me to be able to identify their protective capacities, knowing that they're on the right therapeutic dose, meaning they are taking their meds, they are making sure that their mental health and well-being is paramount while they're pregnant. If they can show that they're doing that, oftentimes the rest of the pregnancy or the postpartum there is no postpartum per se. Maybe the emotional, mild emotional difficult, struggles, but it wouldn't be as severe as someone who never attended to their mental health or even sought treatment while pregnant or even before pregnancy with the diagnosis. Now moving to cyclothymic as well as premenstrual. Premenstrual, you don't really, I know I have had PD, but I don't, which is premenstrual dysphoric disorder, which is the 1 week of feeling low, gloom, not so beautiful, not yourself, just tired and not feeling yourself. I felt that before, and I typically will periodically in the spirit of self-disclosure. And I know other women also feel that because we all have periods. Most of us have periods, and because of that, we don't often need medication, psychotropic medication. Now, Tylenol, Midol, etc. That's also a treatment modality for the pain associated, but not necessarily medication tailored to premenstrual, because it will fall under an adjustment, a change, not necessarily a lifelong phase of hopelessness, so to speak. So now, I mentioned adjustment disorder before. We don't need medication often, but if we are struggling with the transition, as now, this pandemic has taken everyone, most people for a loop, even myself. It's sometimes you can adjust to life. Sometimes you can go with the wave. Sometimes you just can't. And when you can't go with the wave, and when it's too much and it's too overwhelming, it's okay to seek help. So who would we seek help from? Medication management, it would be a psychiatrist or a medical doctor who can prescribe a mood stabilizer. They probably can't prescribe a stimulant, but they can prescribe a mood stabilizer to get you to that place where you feel stable emotionally. Psychotherapy. So that's what I do every single day with my clients. Psychotherapy, specifically CBT, which is cognitive behavioral therapy. What that is pretty much the way you think about what's happening to you affects the way you feel at that moment, as well as, which in turn affects what you do. So psychotherapy, CBT in particular, works as an adjunct, like works together with medication, because they're changing behavioral patterns. They're also changing, we're doing what's known as cognitive restriction, like surgery, but with the mind or with your brain, pretty much, or your thoughts, but with medication to ensure that you have the best experience of life and your child with your child. Psychosocial support. So support is very, very support from a midwife, so a coach, early learning. I mean, someone who is an early child development, as well as antepartum, as well as postpartum, as well as everything else in between. Knowing and having access to someone like that, a coach, a consultant like that, will be very beneficial, because not only do they train you, they will give you, they will walk with you. And I think sometimes, as being a new mom, I wished I had that, because there are certain things that you don't know. You just don't know what you don't know. But now that you know that it's available, I would say talk to people at DBH, our department, and see if there are resources like that. And I strongly believe that there are, just to support you. Lastly, friends and family. If you're in a toxic environment, family wise or friendship wise, knowing what's too much for you, and knowing, creating boundaries will be very important while you're pregnant, as well as once you are you've had your baby. So positive, supportive people. Thank you, Gigi. Yes, so positive, supportive people that will be there for you, support you, give you that emotional support that you need. As a mom, you may or may not go through the best time of your life. You may or may not be going through the worst time of your life. Given this COVID situation and the pandemic, as well as multiple job losses, as well as having a baby, as well as financial struggles, there is a lot going on for most of our moms. And I want to tell you that we are experiencing the same emotions with you, and we can empathize, and we want to link you to resources if you can identify any of these symptoms and you feel like you need help. DBH is here to provide that support for the community. So what type of resources are there? Well, we've already talked about them. I did have one last video, but I'm not going to play it. I'm going to send it to you, Gigi, Dr. Ghislaine, my apologies. So that way you can share it with any mom who would want to probably watch this or see the presentation. Would you like for me to go ahead and end now, or?
Yes, because most people have other meetings and it's 12.
Okay, I figured. Well, so thank you so much for having me, talk and join you. On Tuesday, we'll be talking more in depth about postpartum, as well as on Friday, I believe, we'll be talking about exposed newborn, as well as substance use while pregnant, as the effects of it on newborn and mom, and the societal or the legal ramifications of having a substance exposed newborn case or child, but also knowing how to ensure that your mental health is paramount, is taken care of, so you're living the best life that you can for you and yourself, for yourself and for your child, as well as keeping your child in your custody. Thank you so much for your time. And again, my name is Antonia Levy, as professional counselor, as well as an international psychologist. And I'll be back on Tuesday to talk with you some more.
Thank you, Dr. Levy. Thank you, everybody, for joining. At this time, we're going to end. So again, thank you, everybody, for coming, and have a wonderful day. See if you're coming back at 3. See you at 3. Bye.
Thank you.